This is the Cancer Interviews podcast. Good day and welcome. I'm your host, Bruce Morton. Our guest on this episode not only survived acute lymphoblastic leukemia, but a journey that included 168 days in the hospital. Now she wants to help others on a cancer journey. She is Casey Kang of Santa Barbara, California, and now it's time to hear her story. Casey, welcome to Cancer Interviews.
Thank you so much for having me, Bruce. I appreciate it.
And we look forward to hearing your story. We look forward to hearing about what you do for others. But we want to start out the way we always do with all of our guests, and that is to learn a little bit more about you, your life away from cancer. So if you would, tell us a bit about where you're from, what you've done for work, and what you like to do when there's time for fun.
So I am originally from Chicago, Illinois, and I did all my treatment there. I am a recent transplant to Santa Barbara, California, 2 years ago about. And so in what year are we in? 2025. So 2023, sorry. I had to think for a second. And I am currently a trauma-informed cancer coach that helps women recover mentally, physically, and emotionally from cancer to live a life without fear. For fun, I like to hang out with my dog. I like to cook. I love anything outdoors, like hiking, paddleboarding, spending time with friends, and that is pretty much what I do outside of work.
Wonderful. Well, it sounds like a full life that you're living, and you're in a great place to be living it. Now, we want to ask about your cancer journey, and for all of us who have been on a cancer journey, there was that point in time in which we noticed something wasn't quite right with our health, and that started a lengthy and unpleasant chain of events. For you, when did you first notice something wrong, and what was it?
So it was in 2013. I was feeling tired, and it was at the end of the year, and so I attributed a lot of what was going on to just the holiday stress, work stress, like didn't really put the dots together. So I was experiencing like low back pain. I was experiencing like just bruising everywhere. Eventually, I was experiencing some ocular fissures. So like my vision was distorted. And I finally, what got me to even a doctor was I felt a lymph node swollen on my neck, and I thought I was getting strep throat. And so I was like, I'm going to nip this in the butt before it gets worse, right? And because it was during the holidays, it took me a long time to get into see someone. So it wasn't until like January that I actually of 2014 that I actually saw a doctor. They gave me 2 weeks of antibiotics or 10 days of antibiotics, and then said, make a follow-up appointment in 2 weeks. So I did that. I took the antibiotics. And the day that I stopped, which was a Monday, I had an appointment on a Friday for a follow-up. That's when like my body, just everything exploded. I was getting severe, not nosebleeds, but every time I blew my nose, huge giant clots of blood would come out. I became extremely pale. I was beyond exhausted. Like I would be walking up a flight of stairs and have to take a breath like every few stairs. I started to bruise everywhere. I had clusters of red dots. Like my body just revolted. And again, like I kept going to work because I didn't think anything was really wrong.
But something tipped the scales and made you go back for more medical attention. And I suspect that medical attention led to your diagnosis. If you would describe that chain of events.
Yeah, so that Friday, which was February 14th, 2014, I went in for a follow-up appointment at lunch, thinking I would go back to work. So the ENT saw me and he literally goes, I think you need to see an internist. And so I said, okay. He goes, it's in the next building over. So by the time I walk from his office to the next building over, I check in and they go, oh, here, go into this room. And there's a waiting room full of people. So I was like, oh, that's not a good sign. Like something is wrong and they want to check it out. So the internist couldn't get a pulse ox reading on my finger, all these other things. And he goes, are you sure you're okay? And I was like, I think so. Like, I had no idea. And he's like looking at my body, like with all the bruises that are everywhere. And he's just like, well, very calmly goes, the fastest way to find out what's wrong with you is a blood test. He goes, you can go through the ER, which is you'll get results immediately, or I can, schedule you with blood draw and then I'll find out the results. He goes, however, I'm going on vacation this weekend. He goes, so I won't see the results till Monday. And I looked at him and I said, well, what would you do? He goes, I would go to the ER very calmly. Nothing. So went to the ER, and that's how I found out, and was immediately hospitalized for 28 days.
And that was your diagnosis?
That was my diagnosis. They were 99% sure that it was leukemia. They didn't know specifically what kind, but they took a bone marrow biopsy that Monday, and I started treatment before they got the results back because they knew what it was, basically, based on everything that I was experiencing.
Casey, for all of us who have been on a cancer journey, and obviously that began with a diagnosis, how we handled that horrific news differs from person to person, and really diagnosis to diagnosis. So we already know that it was a horrible day, but given all the variables in your personal equation, how did you handle this news?
Not well and not well. It's hard to gauge it because what is the appropriate response, I suppose. And so my immediate reaction when the ER doctor gave my husband at the time pieces of paper that say that he was like, we're pretty sure this is what she has. And all I locked in my brain was the doctor said something about children's cancer. And I was like, wait, timeout, what? My brain couldn't process what he was saying. So I'm pestering my husband at the time, what does the paper say? What does the paper? He goes, they think you have children's cancer, leukemia or something. And I was very confused. My husband at the time was very confused. And I'm sitting there, the doctor comes in and goes, do you have any questions? And I said, yeah. I go, am I going to the adult hospital or the children's hospital? And he looked at me like I had bumped my head, like I had fallen down and had severe mental problems. And he goes, the adult hospital, as if I'm stupid. And I go, well, okay. I go, I'm just making sure because my husband can't be within 100 feet of children. And it's the most inappropriate joke, but it was something that I needed to say to lighten and feel okay, I'm not going crazy a little bit, but I think I'm going crazy because you're telling me I have cancer at 31 years old. And my brain was not putting the pieces together.
By the way, we hope you'll find time to like and subscribe to our channel. If you click on the bell icon, you'll be notified the next time we post an interview. And we want to remind you on Cancer Interviews, we are not distributors of medical advice. If you seek medical advice, please consult a licensed healthcare professional. Now, Casey, you have gotten this diagnosis and you're finding out you're going to the adult hospital, not the kids' hospital. Mm-hmm. But different types of cancer afford patients a different, for lack of a better word, number of treatment options. Some have many treatment options and some there's only one way to go. For you, did you have treatment options?
I suppose in hindsight I did. At the moment, because I was so severely sick, I did not. There wasn't time for a second opinion. There wasn't time to have a different game plan than what the doctors had already had in mind for me. If there were, I honestly don't recall. I was severely sick, and maybe that's a better question for my now ex-husband. But we were pretty confident in the plan of care, considering what they were telling us we were faced with. But so at that time, because of how sick I was, there were no other options, basically.
And your care plan, what did it consist of? Your treatment, your regimen?
So because it's a acute lymphoblastic leukemia, the treatment protocol is aggressive and it's long. So it was 18 months of chemotherapy. They basically throw every single chemotherapy at you that they can. So like doxorubicin, peg-asparaginase, IT intrathecal chemo, methotrexate. I'm sorry, I always can't, my mouth will not say that word.
I think it's methotrexate, but continue.
There we go. Thank you. Yes. Among very others. I think in total, I did 35 different chemos my first go around.
Wow. Again, we already know that it's unpleasant, but what was the toughest part of the chemo regimen?
Probably the peg-asparaginase, because I had a stroke from it, which left me temporarily paralyzed on my left side.
So with all of the chemotherapy types that you had to go through, the chemotherapy regimen that you had to endure, you ended up spending 168 days in a hospital. Now, we already know that that had to be tough from a physical perspective, but mentally and emotionally, in that space, how challenging was it?
It's extremely challenging. The longest stay was 68 days. And honestly, like by the 60th day, I was going a little stir crazy, as you can imagine. I basically begged them to let me go home because I was literally going like, I can't be here anymore. These walls are closing in and I feel like I'm suffocating. But you don't really have a choice, so you make the best of it. And so what I did was created a routine within the system that I was given. So every day I would still get on the recumbent bike, which was the only exercise equipment available. I would do laps around the ward, which were 17 laps equaled a mile. And by the time that I left, the doctors would be waiting for me to finish their rounds, because I explicitly said, I can't wait for you. I have to do this mentally. Like, I am struggling. And if I don't do this when I need to do it, I can't wait for you guys. Like, you guys can take 20 minutes or an hour and I just need to do this. And, I would shower without being unhooked from my IV pole because I couldn't wait for the nurses. Like, I just took back more control. I never wore a hospital gown or any of those clothes that they gave you, whether or not I was supposed to. I never asked permission. I just knew that mentally I couldn't sit there in a gown every day with like half of my back exposed. Like, it wasn't appropriate for me. So I wore sweatpants and a t-shirt every day. And by the end, I had a friend who made shirts for me, so I could literally just like with Velcro, snap it off and take a shower without having to worry about being like attached to my IV pole. And you just learn that you're not going to sleep and you're going to be woken up, and you do the best you can, and you try to fill the hours and the days that you do have time with something productive and something positive.
During that time, Casey, what did you learn about yourself?
That mentally, it takes a lot to break me. And that I can make the best out of any situation. I can find something positive even when there's no indication that something positive can happen.
Would you say that learning of that mental toughness has served you well in your post-treatment life?
Yes and no. I think I've always known that I've been a very strong person, very strong-willed, I've got a point of view, and I'm not afraid to step into that point of view and go forth. But that stubbornness also probably didn't serve me in asking for help. I needed a lot more I was in therapy this entire time, but I needed a lot more help than I was admitting. And I basically had a big, ugly, messy breakdown, where it finally broke me, going through cancer, and everything just took its toll. And I broke down on my kitchen floor and I just said, I'm not okay. And it was the first time I admitted that, like, you're okay, but you're not okay.
Would you say that if you had to give advice to somebody who has been hospitalized with cancer, would you advise them to be quicker about asking for help?
Yes, 100%. Like the minute you feel like you are wavering, the minute you feel like it's too much, like I was in therapy this entire time and it still wasn't enough. Like I needed way more help than I realized. And so, yes, always get therapy, but also seek out other things or people that can help you finish that cross that finish line, because I didn't realize how much I was struggling until I admitted that I needed help, to be honest.
Now, I want to turn the direction of this conversation and hopefully a more positive direction, and that is, when did you sense you were moving towards survivorship?
It took a long time, honestly, because after my third relapse, we did an experimental immunotherapy in between relapses as well. I was supposed to go on I was supposed to do another stem cell transplant, which they had to get me back into remission. So I did the immunotherapy. And instead of going to another stem cell transplant, my medical team pivoted and said, we're just going to wait and see what happens. Which is kind of like the worst thing you can tell someone who's going through cancer. We're just going to wait and see if it comes back, right? Like, that's not a plan to me. That's like, we're just waiting for it to come back and kill me. Great, awesome. And so I lived like that for 6 months, basically, with going to my oncologist every week. And they're just like, you're doing okay. Like, keep going. And then my oncologist would put her hand on my shoulder and she goes, baby girl, we're just lucky you're alive. And I'm like, you're telling me this? Was it that bad? And no one like indicated that to me either. Like, so I lived like that thinking I was going to die for a long time, and getting out of that mode of thinking that took forever. It took me a solid 1.5 years, I think, to finally feel like I was quote unquote actually okay.
And to what degree did anxiety stir into this mix?
Because of that ambiguity of my doctor saying, like, we don't know, we're just going to wait and see, it did not help. I woke up every day doing some very, what I would consider strange things in hindsight, but in the moment made total sense to me. Like, I would get up and wear the same clothing because I was like, I don't want to jinx my cancer to come back. I'm going to eat the same thing because what if it's something that I'm eating? I'm going to do the same thing because what if it's something that I did or didn't do? And so it became like prison to me, mentally, physically, emotionally. Like, I felt like I was living in this Groundhog Day, a perpetual, like, do the same thing because you don't want to do something different. And then it comes back because you did something different that day. Like, I couldn't plan for anything. I couldn't live beyond that day that I was living. And it was torturous, to be honest.
But Casey, eventually you survived acute lymphoblastic leukemia, I should say. These days, physically, mentally, emotionally, how close are you to 100%?
Oh, I'm beyond 100%. I'm 43 now and 25, and I am not on one prescription medication. My doctors I just went to the oncologist earlier this month, and I go every year because that is what my protocol calls for, because I've done some things that are quote unquote considered experimental at the time, so they don't know the full outcome of what's going to happen. For longevity purposes. And the doctor looked at me, he goes, if I didn't know you had gone through cancer, I would never have known it based on the lab work, all of how you look, how you feel, how everything. And I was like, okay, that's amazing. I'll see you in a year.
Well, I'm no doctor, but you do look like the picture of health. Now, let's move on to what you are doing in the here and now, and going forward. If you would tell us how you are helping female cancer patients deal with the post-treatment trauma, and I'll throw out that operative word because you mentioned that is part of the credentials that you have now. What do you do, excuse me, to help other women who are going through the difficult post-treatment phase?
It's a lot of things. It's not just like one thing, because I personally believe the minute you hear the words "you have cancer," it creates its own level of trauma. There's not one person that I know that hasn't experienced it on some degree, right? Because trauma can be degrees. And so I take a whole body approach. So physically, I believe movement is the catalyst for change. And so getting us physically moving is a huge part of that. I believe that we can live a life without fear. I'm proof of that. My clients are proof of that. And without the maddening anxiety of every day thinking your cancer is going to come back, through nervous system regulation, through yoga for trauma, through a couple other different modalities as well, you're given basically a toolbox of tools to use every day. And then lastly, it is how do you reset the expectations of what your life is and what it's going to be when you thought your life was headed left and you're going right now. And to open up the possibility that even though this isn't what you planned for, this plan might be and could be better than what your original plan was. And so it's building that confidence to know that like this isn't going to be your defining factor if you do not want it to be, right? This doesn't have to define your life in a way that hurts or helps you in any form. You get to choose that.
Excellent. Casey, thanks so much for a compelling story told in an eloquent way. And before we go, we want to let viewers and listeners know that if they want to avail themselves of your services, how do they do it?
So you can find me on Instagram and Facebook. I'm at The Happier Hustle. And I also have a website, obviously, but reach out at any time. You will literally talk to me. You are not going to talk to a robot ever or another human, because I believe in the care of each and every one of us. It deserves that attention.
Outstanding. Casey Kang, Santa Barbara, California. Thank you very much for sharing your story. Thanks for being with us on Cancer Interviews.
Thank you, Bruce. I appreciate it.
And we want to remind you, as we always do when we conclude, that if you or a loved one are on a cancer journey, you are not alone. There are people out there just like Casey Kang who have information that can inform and inspire. So until next time, we'll see you on down the road.